have to offer, I think, is great. We have some prescriptive medicines, we have some non-prescriptive medicines, but I think what we have a lot of is time. Here it's a walk-in clinic. If we want to take 10 minutes or 30 minutes, we can do that. And I think that's real important when you're talking about homeless people, that you show you have the time to spend with them.
You have to just let your patient talk. You never want to cut them off, because when what they think may not be important or what other people think may not be important, it gives you clues as to their health care. It gives you clues as to what's going on in their life, and then that helps us to better diagnose them and in turn better treat them. But yeah, sometimes you just have to let them speak.
When was the last time you checked your weight?
I think I see a lot of people being told they had a condition and then, oh, you know, I just can't keep up with it. I'm just going to let it go because I really have to worry about my homelessness. And granted, they do need to worry about their housing situation, but you know, if they don't take care of their health care need, being homeless will be the least of their problems in some cases.
I think when it comes to us as a medical staff, because there is that underlying law in regards to what you say between your provider and you is between you and your provider, there's a little more trust. So they listen to us a little bit more sometimes. Sometimes we're able to get across the mission of the mission, and therefore that they adapt to the program and they explore the program and realize that, you know, we are here to help them.
3. Nice job.
All right.
I want them to have a family practice or a primary care provider. That is the way that there is a central location for all of your records, so that one person sort of is helping you keep track.
My goal coming in was to let them know that just because you don't have coverage or just because you don't have the money that someone else would to pay for certain medical things, I wanted you to know that it can be done timely, it can be done effectively, it can be done with care, and that wasn't what I experienced in the past. So I think if I had a preconceived notion, the notion was that maybe they hadn't received the best of care, so my job was to change that.
Let me just start by asking you if you're allergic. I say to them sometimes, what could I do to give you that much more comfort? You know, would it be some cough syrup? Would it be a lozenger, a pair of glasses to read your Bible, a foot cream? You know, tell me if I have it, I would really like to provide it for you. You know, no, it's not going to take your troubles away, but if you're comfortable for, you know, 5 more minutes out of a day, I think it's worth it. And that's what I think my role is.
Anytime that you take anyone out of the comfort environment that they have and put them in a totally different environment, you know, there's a stress level. So then you add that to a child who everything is already new to them, and now I've taken you out of your home, and now I've put you here where other people are. There's different rules, you know, mom has rules, the shelter has rules, you know, there's different food, everything's different. So yeah, the stress level is high for the children, and then in turn that makes mom, who already had a high stress level, now it's also increased as well.
I'm gonna give you this chart, and I want you to put her in the system.
I'm so happy to be able to provide care in this kind of setting. People are very grateful. They're very kind and considerate. I've never had a bad patient here, ever. You know, even people that get upset and get angry sometimes, I get that. You know, they all come around. And you know, there are some people that they just don't know. They don't have enough information, and I think that's part of what we're doing here, is informing people, making them better patients.
If I can give back to the community that my mom was raised in, the community that my family is still in, then that's my job as a person, that's my job as a part of the community, and that's what I have to do. So is it fulfilling? Yeah, I think I get more out of it sometimes than they get out of it. So I wouldn't trade it for the world.